Hello everyone, I'm Dr. Akif Beg. Today we will be talking about monkeypox. Monkeypox is a viral zoonotic disease. So what do you mean by zoonotic disease is that these are the diseases which are spread by the animals. So zoonotic means through animals. So any disease spreading by animals is called as zoonotic disease, and monkeypox is found to be occurs due to spread by a monkeys. So that's why it is called as monkeypox virus. So based on his history wise, it was first discovered in 1958 while because normally during the research time, monkeys were used for the medical researches and all, and it was found that through the monkeys which are used for research, cases were identified. And first human case was identified in 1970 in Democratic Republic of Congo during the smallpox eradication efforts. After that, there was not much disease, much spread of this monkey virus, and it has become endemic, that is localized to several Central and West African countries. So based on current situation, so why are we talking about this monkey virus now? Is that now we have seen that there are over 1 lakh confirmed cases of monkeypox virus from 2022 to July 2024, with over 200 deaths has occurred because of this monkey virus. So how does this disease spread? So this disease spreads transmission can occur from animal to human transmission and or human to human transmission. So animal to human transmission means if any person is exposed to or comes in close contact with the animals like monkeys, rodents, that is rats or squirrels, are found to have a higher chances of transmission. And this transmission usually can occur through the bite, scratches, or direct contact with the blood or bodily fluid. Human to human transmission can also occur due to close contact. That is, if any patient is infected with a skin disease or skin lesions, so the disease, if any other person comes in contact with those skin lesions or contact with this person, the infected person, so there can be a spread via respiratory droplets as well. Respiratory secretion, so prolonged face-to-face exposure can lead to transmission as well. And this can also be found to be transmitted mainly in sexual transmission, and this was particularly found in men who have sex with men. So this spread is also was again found more due to the close skin to skin contact rather than the actual sexual activity. And this virus is also found to be transmitted from mother to fetus, which is called as vertical transmission. So coming to clinical features and or what are the symptoms of is that. So first we should know that what is incubation period. It means that so whenever any person is exposed to the virus, so suppose you have been exposed to a patient of monkeypox virus, if you're exposed, so after how many much days you will get symptoms. So it is the time duration from the exposure time to getting the symptoms, and it usually lasts between 5 to 21 days. On average, it is said to be 1 to 2 weeks. So what are the symptoms of monkeypox virus? Is initially it is called prodromal. Prodromal means there are generalized symptoms or non-specific symptoms to a particular disease, and the symptoms can have a high fever, severe headache, lymphadenopathy, muscle aches, that is muscle pain, excessive fatigue, and back pain. So once this initial prodrome period has finished, that is usually 1 to 3 days, after this 1 to 3 days of fever onset, patient usually develops skin diseases, which can progress from macules, that is the flat skin lesions, to papules, that is the raised lesions in the skin, and vesicles. And this lesion typically start on the face. As you can see here, the face is the most commonly involved, and you can see here there is a formation of the papule. Here you can see a lot of papules are there, and you can also see there are pustules or pus-filled scabs is there, and these are the skin lesions. So it looks deadly as that this type of skin lesions occurs in patients of monkeypox. So after getting this infection, how much of time does this infection last or the symptoms last? The illness usually lasts for 2 to 4 weeks and depends upon patient to patient. However, generally it is mild and recovers without any treatment. However, severe cases can occur in patients who are immunocompromised. Suppose any person is immunocompromised, there are occurrence of severe cases has been identified. So what are the complications of monkeypox? Is secondary bacterial infection. Because the skin is exposed, this skin can get infected by the other bacteria, secondary bacteria, And due to those infection with the bacteria, the patient can develop major complication. Patient can also develop respiratory distress or lung disease, sepsis because of the spread of in secondary bacterial infection. The infection can spread to the blood called as sepsis. Encephalitis, that is the infection of the brain, and the corneal infection, that is the eye infection, can occur. The case fatality rate is generally low but higher in immunocompromised patients. So the mortality rates are higher in immunocompromised patients and children, but it is quite low in adult patients. So how do you treat a patient of monkeypox? So currently there is no specific treatment. It is mostly supportive care. So what do you mean by supportive care is that suppose a patient is getting fever, you will give him paracetamol for controlling fever. If a patient has pain, you can give him painkillers. And hydration. So efficient hydration is important because the skin, there are a lot of skin lesions. The skin is exposed to the outside world environment, and there is high chances of losing of lot of water from that. So that's why the patient is tend to get dehydrated, and hydration is the most important thing. Secondary infection should be treated with appropriate antibiotics. So suppose we want to give antiviral medications, the drugs which we have available is one is called as tecovirimat. This is recommended for treating the severe monkeypox cases. This should not be given to all the mild cases because this is associated with side effects as well. So it has to be given mainly in patients who have severe monkeypox, or especially in immunocompromised individuals, or those at high risk of severe diseases. Another drugs which are available is cidofovir and brincidofovir, and especially it is given in patients with encephalitis or other life-threatening conditions. Coming to vaccination, so there is one vaccine which is available for monkeypox. It's called as genus vaccine, and it has to be usually be can be used post-exposure as well. So suppose you are exposed to a patient of monkeypox, so you can take this vaccine to prevent you from complication. That is, it has to be administered within 4 days of exposure. It is a live, non-replicating vaccine, meaning it cannot cause infection. Indication is it has to be given only to high-risk groups like healthcare workers, those with confirmed suspected monkeypox exposure, and immunocompromised individuals only. There are 2 doses to be taken, which is taken 28 days apart. It can be either given subcutaneously or intradermally. Efficacy provides strong protection, especially after completing both doses. Side effect can be only mild, such as redness and pain at the injection site. Isolation period. Suppose you have got this infection. So for how much duration, the patient should be immediately isolated. And this isolation can be either in hospital or at home. And generally the isolation period should be till the time all the lesions have scabbed. That is, the lesions has completely scabbed and a fresh layer of skin has developed. That is the duration of isolation period. Generally, it lasts around 2 to 4 weeks. Case fatality rate. Case fatality rate, that means that the suppose how many persons will have death if they are exposed or got infected with monkeypox virus. It is found to be 1 to 3%, and generally it is even low. This 1 to 3% is also seen in children's or patient with immunocompromised state. I hope you have liked this video. If you want more videos like this, do subscribe to my YouTube channel, Dr. Akif Beg. Or if you want more videos like this, we have our Infusion Medical Education Zone. Or you can visit our website, www.infusionmeds.com, for more medical educational videos. Thank you.